So there's a lot of changes from the proposed to the final. At first glance, it didn't look like there was that much difference, but there really are. And so from the proposed NCD, there were things in there like you had to have high intensity therapy for BiPAP at 20, IPAP of 20 or more, which was pretty high, which came from some of the European studies done in the 90s, early 2000s. There were some other things in there about compliance having to be 5 hours every day, basically. And so then there were some things in the proposed around blood gases and continuation of blood gases to be able to prove that the patient needed the therapy. A lot of those things got changed. And so in the new document, it's much better than what was proposed. The proposed document was not very clear, had some confusing things in there, and was almost impossible to implement. The new one, at least we feel like is possible to implement, but it's definitely going to change your business. And so one of the biggest things is compliance is now in line with CPAP, which is 4 hours a day, 70% of the time. And then also you've got the continued coverage criteria, which says you have to now get the patient compliant in the first 6 months, which is different than CPAP, where it's the first 3 months. So you've got 6 months to do that, so a little bit more leeway. But the thing that has really changed is the ongoing compliance portion of the NCD, and that says that you've got to get the patient compliant in the first 6 months, and so you've got to find 30 days of compliance in the first 6 months, and then 7 months to 12 months, you've got to show that they're compliant every single month on a RAD, and then on a ventilator, it's pretty much forever. But there's 2 periods in there where a physician has to, it says a clinician in the document, but we're everybody that I've talked to says that is the provider. And so the provider has to do an evaluation at the end of 6 months, and then has to do an evaluation between 7 and 12 months to be able to document compliance and the need for continued usage, which could be a variety of different things, looking at, did we improve their CO2? Is it stable from baseline? Did we improve symptoms? So we're looking for some kind of markers that says the patient is using the therapy and it's working, and there's some kind of improvement in symptoms or in CO2. But you have to have 2 follow-ups now within the first, or at the end of 6 months, within 7 to 12 months, and then you have to track compliance forever on a ventilator patient, or on a RAD device or BiPAP. It's going to be just in the months that you're billing. So if you're capped at 13 months, you got to track compliance every single month from month 7 all the way through to month 6 or month 13. So it's essentially going to change the business quite a bit, because historically we've not really had to track compliance, and everybody had their own definition of what compliance looked like on ventilation because it wasn't set in stone. And so that's going to be the biggest kicker, I would say, is that less patients are going on therapy because you have to have a CO2 of 52, greater than or equal to 52, to get somebody on therapy for a RAD or a vent now. So that is it's new in the sense of, before there was really no guideline. It was just diagnosis specific. So now you've got to have that CO2 no matter which device you're going on. And then, which means we're not going to get patients on quite as early, and it's going to really kind of change the way we qualify patients. And then which device do they go on when they do qualify is going to be determined on a bunch of different factors. But from what was proposed to what is now, there's lots of changes, some improvements, some things still need some clarity, and we're hoping we can get some clarity in the LCDs, which I know Home Care and VGM, all the organizations are looking at how do we clarify some of those things. But there's a lot to digest, and there's a lot to take in, and it has to happen pretty quick. So you got to be on top of this as a DME provider right now.